Good morning, everyone, and welcome to today's Caring for the Caregiver webinar on COVID in our community. Where are we now? We're happy to have you join us today. This event is put on by Sutter Health Memorial Medical Center, and Community Hospice is happy to host. Our presenter today is Mr. Paul Mon, and Paul is the interim infection preventionist with Quality and Safety Department at Sutter Health Memorial Medical Center. He's a strong team. He's joined the strong team at Sutter and brings a strong background in clinical microbiology, having worked with real microbes for 16 years. He's a graduate of the University of Toronto in Canada, and he is board certified in infection control and brings over a dozen years in reducing healthcare acquired infections over the United States. Paul, we're really happy to have you join us today. I know you're super busy, so thank you for taking the time to join us and provide us updated information on COVID and where we're at in our community. It has affected all of us, so we're happy to have you present today. That being said, as a reminder, we are recording this event, so if you missed it or would like to share it with your friends and family, please feel free to do so. It will be up on the Community Hospice YouTube channel in the coming days, and we're happy to have you share that information. So with that, I do want to remind all of our guests that this is an interactive meeting. So if you'd like to turn your cameras on, you're welcome to do so. If you'd like to ask questions throughout the presentation, that is always helpful to Paul as well. And so please feel free to speak up throughout the presentation. If you do not feel comfortable, you're always welcome to enter those questions or comments into the chat box, and I'm happy to moderate that and ask those on your behalf. So with that, Paul, I'm going to go ahead and pass it off to you. Thank you.
Thank you, Kristen. That was, when you talk about the introduction, suddenly, you go back in time and say, darn it, that's a fair bit of excitement that I had being in different kinds of microbiology settings. And now with this COVID. Before I get started, I want to make sure I get a feel as to what sort of questions that you are bringing to the table, so I can try to weave that through my presentation. Are there any questions related to COVID that you have? If not, you can always ask me later. My presentation is going to start. The first slide, please, Kristen.
Sure. And there is one question, Paul, that just came in. And that question says, do you have any influence on Stanislaus County pronouncements?
What they do is they take actually input from all hospitals, but they do make their own decisions in conjunction with the state. That is our input is with respect to our staffing, our resources, the sort of patients we are seeing, what is our positivity rate, that sort of thing gets fed into one central filter, and then it's combined with other hospitals and with whatever the state standing is, and then they filter it out and they put it on the website.
Okay. And one additional question is, what is the main message that you would like to get out to the community?
The message is, from personally, as a microbiologist, I will say that even though there's a whole lot of now a confusing thing with respect to should we be wearing a mask or we should not be, should we be getting vaccinated? And I'll dwell on that one. That would be my main message, because after all, you're here to protect yourself and your loved ones. At the same time, also build up a community immunity as well. So with all these yo-yos, differences in message, as we have been going through getting into the third year of the school year, people have a lot of questions. And I'll just give you some sort of a universal way of protecting yourself, not just for this pandemic, but for influenza in general and viruses and bacteria going forward. So that will be my main message that I'll end up leaving.
Okay. And then one additional, it says, can you also comment on the COVID status for children in our community?
Now on the COVID, that is something we do not collect that at the hospital. We have it mostly because it's an adult hospital. We have a little bit of peace department. So I cannot comment on this one. So I will have to hold back on terms of vaccination for children from our data. But whatever I will end up saying will be something that you probably are aware of it from the news sites. Because there are some progress being made on vaccinating children, which I think is very encouraging. So I'll dwell more on the adult side of the business.
Perfect. And then one additional question was, why don't we wear masks for the flu?
Why do not we wear the mask for what?
The flu.
Okay, that would be another good thing that I've thought about. And something that I strongly recommend that people be doing that going forward. With respect to that question about the flu thing is, we had a hard time in the hospital setting if somebody was to wear a mask. Because it was more of an image thing that the hospital said, well, people think that you got something communicable, you got a mask on, I don't want you to handle me. So that is why masking wasn't a standard practice. So we would only have people to wear a mask if they were not staff members, if they were not vaccinated. However, we would not generally have them put out in the public view because of the public perception that there is something contagious going on at the hospital. So people were not readily doing masking. However, in certain parts of the world, it is quite okay because they've been doing it for several years. They wear masks when it's dusty. They wear masks when they feel like that they are not feeling very well, or they wear masks when they think that the patient that they are going to be encountering perhaps could be carrying something communicable. So masking in certain countries are okay, but in North America, masking is not really looked upon as very healthy. However, I'm hoping with the training that we got and all the information, excuse me, that we have with respect to if you were to mask, how many people do not get sick? For example, last year, during the flu season, we hardly had flu. And it goes back over to our masking technique. So if you mask, you create a barrier. You're not necessarily going to pick up the bugs from others or share yours with the others. So masking for a microbiologist is actually a very good thing. If along with that one is the plastic barriers that people have at the tellers or the cash, that's also a good physical abatement of passing of bugs. So I'm very pro on masking, and I hope that you carry on this to keep your sickness low. And why would somebody say, well, I got a vaccine, I took a flu vaccine and I'm not going to get sick, so I don't need to mask because mask messes up my face, however, what goes on is when your body gets challenged multiple times with different organisms, your immunity goes up on high alert. When it goes on a high alert, your body gets tired. Your immune system also gets fatigued. So we want to make sure that we do not give that many opportunities for our body to be constantly on an active get-go. So when you wear a mask, the bug doesn't get in your body, your immune response doesn't trigger. So your body's what we call the homeostasis or the balance stays intact. So putting it all together, barriers are a very good way of preventing illnesses to others or getting it from them. Any other question, Kristen?
I don't see any other questions at this time.
Those were very good questions. So if we don't have any more questions, I'll just go over to the burden of coronaviruses in the state and then in our county. You're looking at a slide. This is coronavirus disease statewide, and it might be a little stale dated, even though I got the data on the 8th of February. at 10:44. At the time, the total cases in the state was 8.66 million, and there were about 37,000 more added in that time period. And the deaths were 81,529 with about 190 more added. So what are we looking up here? Coronavirus statewide. Is there another slide before this one?
Nope.
No. What about the one in front?
This
This one is to New York. Okay. So okay, yeah. One go back, please. Yeah. Okay. This one says coronavirus disease in our county. But this one is, if you look down at the bottom, I don't know if you can see my cursor move. You see United States, and then the second box in the middle. Then it says California. So this is what on all counties together. So as of January 28th, the new cases were 75,826, and the 7-day average was 89,558. The main thing about this one is we do have those bars going up and going down. But if we look at the 7-day average, it kind of it gives a better understanding of which way we are headed. And the way we are headed is actually, it's coming down. So our 7-day average is quite a bit lower versus say on January 10th, when it was much higher before. Now you notice that going back to November, it was really, really low, started to creep up December 13th onward. And then by the 27th, it had gotten a good foothold, and it just went on climbing. And part of the reason is this is December, we have Christmas and New Year. So people get together. So we do share our bugs. And that is also the time that the temperatures dip down. So people are much closer, the air is thicker and denser. So the bugs normally pick up. In a hospital, we are always looking for pneumonias during this time. And also heightened influenza. But because it's a corona and with a new strain, it picked up as people were mingling together. And on the right-hand side is a map of all the cases. And you can see in Los Angeles is the largest share. I think the LA County is the largest county in the state. So you have a larger capture area. And then you have in San Francisco, you have smaller communities, San Jose. So this one just basically tells you how it is spread out. It is spread out pretty evenly. However, it is more clustered towards higher dense areas. And higher dense is more people per space. So we do share those bugs quite often. And let's move over to the next slide, Kristen, please. So this is pretty well, this is our in the United States, this is in California, and this is in our county, and this goes back last 3 months. So our case rate was 1,477 were new cases, and 7-day average was 1,273. It pretty well followed the same thing. At that time, I think it was around December 10th, started to climb up. We actually saw it much later up in the county, almost close to New Year. And it climbed up pretty fast, almost at about a 45-degree angle. And then somewhere down around January 28th, the cases started to fall down. The 7-day average started to fall down. So currently, we are doing very, very, very well with respect to the new variant of COVID. And so that's the basic message between these two, that things are improving and our caseloads are coming down in our county and in our state. Next slide, please. Now here is this one that I got from the California State University, and this is very timely information that it changes very often because it's kept up to date. So the data is as of January 31st, new cases were 516. And one good thing is there were no deaths. And another good thing is that who are the people who are fully vaccinated? Fully vaccinated means they got the first dose and the second dose for Pfizer and Moderna. and a single dose for Johnson Johnson. And partially vaccinated were about 14%. And our positivity rate is 16.5. So positivity rate is something that we actively look into, and that gives us an idea the number of people who are coming in to the hospital or healthcare, how many people are positive. So this is 16 people out of 100 are positive for COVID. Now you could be positive for COVID, but you may not have a symptom. So that goes towards the case definition. But generally speaking, when the positivity rate goes up, I think at one point it was around 38. Anytime it's less than 5, we are in the green zone. Anytime from 5 to 8, we start to go into the amber zone, and then anything over about after 10 and beyond, we start to take it quite seriously. And so our positivity rate is still not out of the woods yet. We still are at 16%, but well below what it was about a couple of weeks ago at about 38%. And so that was the message from this slide. And you can see that on the bottom, the peaking happened around those time, will be around Christmas time and New Year's time. And now it is now started to come down. Okay, we have a question is, has the overall vaccination rate changed in our county? Yes, from 56% to about 69% right now who are fully vaccinated. So which is a very, very healthy mark, because I think in LA County, if I recall, was close to about 75, 78 or 80%. And San Francisco could be close to that number as well, if not higher. Okay, at what positivity ratio we feel comfortable to go back to normal? Now, what is normal? Normal means when you don't get sick. That will be a normal. Normal during pandemic times takes a while. What happens is it's the same thing like people who are sick and coming out of the hospital are not fully healthy. They need to recuperate. So our body systems are recuperating. There are people who are still growing bugs in their respiratory system. For example, I am fully vaccinated, excuse me, and I got my booster shot. Well, however, what happens is I will not get sick, or what they normally say is you're not going to get severely sick. But at some very low level, the bugs are still in my mouth, in my nose, and they are still mutating. So if they're there, then they are going to be changing. This is a normal way of how microbes do. So they are mutating. However, their count is not large enough to cause me sickness. But if I come across a person who's getting chemotherapy or a person who's immunocompromised, this small inoculum, which is keeping me healthy and not making me sick, could be large enough for the immunocompromised person to get seeded and get sick. So this transition is going to take a while before we really start to drop our guard. If you hasten it, you're going to find out that you're going to end up picking up something or giving something over to someone else. So I would say that your normal masking, which is something like this, it doesn't really prevent you from not breathing, because the other N95s can be you have to put a lot of effort to try to suck in air. So keep that guard there. Okay, for those of us who are vaxxed and boosted, what are the most important symptoms we should look for? The symptoms for COVID are pretty well the same. They will be milder. They will almost pass like a cold. The difference between COVID and a cold is more likely you're going to get fever. And then the typical are the loss of taste or smell. COVID has many symptoms, more than a dozen different symptoms, but they do overlap with others. Influenza, common cold. So the ones for COVID are down to loss of smell and loss of taste. Uh, so COVID symptoms, you have to be guard on. You basically have to be on guard for respiratory issues, where you have shortness of breath, more effort in breathing, um, your oxygen levels goes down, something similar. Anything that affects your respiratory system, regardless of the microbe which is doing it, is a cause for concern that needs to be checked, and making sure that you do not have COVID.
Hey, Paul, there's one additional question there that was, how do you feel about the lower quarantine time now suggested?
How do I feel about the alert? What?
The lower quarantine time that is now being suggested.
I missed out the last two words you said, the low one.
Oh, lower quarantine time.
Oh, the lower quarantine. Mm-hmm. So in other words, we are not isolating more people. That will be the lower quarantine. When you do this, the quarantine for infection prevention is at different stages. Where it could be a severe case, a moderate case, or a low case. When you're using just like a mask like this, it's not really quarantining, but you're basically just sort of preventing a mix-up of bugs. However, if I was to wear this surgical mask, and this small room that I have is by almost like 8 by 10, and if I have about 2 people in there, we got to wear a mask, and we shouldn't hang in here for too long. Because this thing is only about 55 to 65% effective. And that also for larger droplets. If there's somebody singing, then then only 1%, because it goes much farther. So the quarantine, you have to be cognizant of the distance, but from you versus the other, and the other person could be very healthy. So that distance, why we get the distance is majority of the bugs that escape our masks are going to fall very close. And that's why we are distancing. When you get very closer, you wear the same mask, then you are really jeopardizing your health and the health of the other person. So I would think for quite some time, even though the quarantine level by the state may come down, but you want to make sure that you at least have this barrier. And like, for example, I travel a whole lot. I will in a plane, because it's a person is just sitting elbow to elbow, so close. I will not only wear an N95 mask, but I also wear a baseball cap, so it has a little bit of a shelter for the airflow coming from the top. Or I will have a face shield, because the density is a lot more. But a pilot over there could get away with the other guy just with a face mask, which is a normal surgical mask.
Great suggestion. Hey, Teresa, I'm not sure that your question was answered. Do you want to unmute yourself and ask it in a different way?
Yes, thank you. I was referring to the mandated number of days once a person has been identified as being positive. I believe it's now 5 days, is that correct?
Correct.
Okay, but do you feel that's adequate? I'll give you an example. I had someone who was supposed to come to my house and had been identified as having COVID and had only, it was like the sixth day afterwards. I'm being very cautious with exposing myself to anyone at this time. And I know that it used to be, I don't remember, was it 10 days, 14 days?
Yes,
it's
10
been
days.
lowered.
I started with 14, then went to 10, now it's 5.
Now it's 5. I guess what I'm asking is, do you feel it's safe to interact with somebody on the 6th day after that person has been identified as having COVID?
Okay, here's the thing on this one. Why 5 days? Why 10 days? Why 14 days? Initially on, we did not know what the incubation period is. Now, for the incubation period means what is the inoculum size? In other words, if you want to hatch chickens, should you put in 8 eggs and then have the mother chicken sit on them, or 8, because the chances that 7 could be dud and 1 could be good, or it should be just 1. Since we do not know the inoculum size, then that smaller inoculum has to multiply in the human body to get to the point that it becomes infectious. So even though incubation period, generally speaking, of a virus is anywhere about, say, 4 to 5 to 7 days, but we do not know what the starting point is. So as a result, it starts to creep up. So it will be more of a case to case, but if generally I was to mingle with someone, I'm always keeping it my safe distance, and I'm always keeping a mask on myself. And
Thank
more,
you.
yeah, and at the same time, I'm not mingling with with strangers as well. So I'm dealing with my friends who I know
Right.
really look after themselves.
I thank you.
You're
Thank you.
welcome. Okay, let me just get back into my computer because it went stale. Yeah, back here. Any other questions? Those are great questions. I love that because it makes you think, because you need to get into the logic of how these viruses do what they do. Case in point is influenza. This bug is an RNA virus. So is influenza is an RNA virus. And these viruses mutate a whole lot. What is the best response to those who challenge your choice to wear a mask? Okay, if somebody was to challenge me, why are you wearing a mask? I tell them right away, I'm a microbiologist. I work with these bugs. I know them quite a bit more than a normal person is, very intimately, because I have had these things splashed on me and I've seen other people get sick. So I am taking my precautions. You may or may not, but however, if you're not going to be masking, I will have to increase my distance from you. Right? Because barriers, you have to have a barrier and a distance, and also a good flow rate, because in case one hospital I worked where in a lunchroom, there was no air exchange was not fast enough. So there were more people who were having lunch and then all of them got sick. So the spacing, distance, and the airflow are very critical. And now you just imagine yourself. I think I gave it more of an example of a dust factor. So you have dust falling into a house. We all clean our house. Certain spaces within our house are much dustier than the other. If you look at your air, your supply airs and your exit airs, you will very well notice why dust is collecting very more so on your ceiling, where the supply air is coming. So it's the same thing. Bugs are pretty well the same thing because they're particles. They're smaller particles. Anything else? I love those questions. Please don't hesitate to ask me. I'll give you my opinion as to what I have observed working in the lab sciences. Next slide, please. This is our hospice experience going way back since COVID started. And you can see that we had a COVID, then we had a Delta spike, and then we had the Omicron spike was later. And I don't know what they call that, a mixture of in August. Is it, I cannot say that for sure. Because it came up with the Alpha, then Beta, then Delta, then Omicron. So we have spikes. If we come down, we go spike. So at what point are we going to consider it as a safe zone? We do not know. So even though others might be saying that you got to drop your mask, I'm thinking about, we really do not know that if we are going to have a very strong mutant that's going to come out. So I'm going to keep my barrier on. Next slide, please. Okay, somebody had asked about the symptoms, and here said, so first of all, get vaccinated. Vaccines are widely available and free. So COVID-19 affects different people in different ways. Infected people have a wide range of symptoms, reporting from mild to severe illnesses. older adults and people who have underlying medical conditions like heart or lung or diabetes seems to be at higher risk for developing more serious complications. So the symptoms may appear 2 to 14 days. Now here is where that 2 to 14 days comes up versus the question that I believe Teresa asked about the incubation period. The incubation period comes up 2 to 14. If we got a heavy dose, it could be 2. If you got a light dose, it goes up to 14 after exposure to the virus. People with the symptoms may have COVID, and you can read all those, pretty well, those are respiratory illnesses, except for diarrhea. Yeah. And then looking for emergency warning signs for COVID-19. If somebody is showing any of these signs, that's another one that that I believe Teresa had asked, trouble breathing, persistent pain or pressure in the chest. And then, of course, there was a question that got flashed, but it went away. Can I see that, what it was?
The question?
Hey, I was wondering what you felt about the new Omicron variant that's being discussed. I understand that at this point, they're not thinking it's a great threat, but I was just curious about your take on it.
It's not a great what?
I've heard or read that at this point, they're not thinking the Omicron variant is a great threat, but I was just curious about your opinion.
It is true. Why we say it's not a great threat? Because the symptoms are milder, even for people who are not vaccinated. People who are immunocompromised and older, they are going to be in trouble anyway because of the compromised part of the anatomy. But for people who are vaccinated and they are seniors, their symptoms are going to be milder because the whole part of your body is already having pre-existing antibodies that are going to fight against the infection. So your symptoms are going to be milder versus a person who is not vaccinated. Now, when they say that this is a milder, I don't buy it that it's a milder, because time will tell you if it's mild or not. Because just like the peak curves that you've seen, somebody could have said, well, things are improving, we should be okay. And I know that the counties were relaxing the rules, dining rules. However, I will be on guard because like anything else, things are still brewing. When they get expressed is anyone's call. Since we are in the stage, we are still in the pandemic stage. So I would not give up my barriers and my distancing. And that will be my safer zone. And part of the reason is that you are vaccinated, but you will still be having a small quantity of bugs, which are mutating, and who knows which mutant is going to come out and spread. And that's why why now it's getting to the point where governments are saying that it's affecting our economy a whole lot. So the economy now gets into the equation of masking or not masking. So it is a very complex situation and many gears are working together. However, on an individual level, you have to make sure that you stay fully vaccinated. A new vaccine booster comes up, I take that. Number two is do nasal rinses. Nasal rinses, anything that gets planted, anything that gets seeded in your nasal passage will be rinsed away. Otherwise, it gets seeded and it grows. So that's another good thing. Change your mask often. So sometimes they look pretty clean, pretty good, but they are pretty well saturated with all the contaminants. So I would change one a week minimum, right? Wash hands anytime you touch your face. Don't plant your eyes, your nose, your mouth, your ears, not ears as much, but your mouth, nose, and your eyes with your hands. So what I learned from the lab is I never scratch my face or touch my face with an open palm. I use the backside of my hand, which is the low touch area, to scratch my face. So get into those kind of habits. And I'm telling you, though, I mean, we worked with trillions of bugs. We spilled on ourselves, but yet we were healthy because there are certain laws that these little critters follow. We humans may overlook it, but we are now learning a whole lot from animals. and bacteria. That's what was the fun part of me working in microbiology, was it tells you before things happen, because these things are self-guided by virtue of the DNA commands. We might have opinions, and every person might have, 5 or 6 different opinions. And so as a result, we subject ourselves and victimize ourselves or others. So my lasting message, as I said earlier, was keep yourself protected. I didn't mention the nasal rinses before, but I found them very effective. Even before COVID came in, I got far less sick. I always get my flu vaccinations, but you can always pick up cold viruses, which are different than the influenza viruses. But I started to see that my nostrils were not dry, and I was getting far less sick. But please, 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 whatever others say or do, right now we are still, yes. Can you recommend a nasal rinse? Yes. There is one thing that I got from Amazon for about $70. It has a pump in there. It pulsates versus a neti pot which is just guided by gravity. This one pulsates, and so with a pulsation, it kind of jostles the bugs or pushes them around, so they get loose and then they get flushed out. I think it's a nasal something it's called. But if you look at nasal pure or nasal rinse on Amazon, you can come. This is the only one. A Sinu Plus, Sinu Pulse, SINU, and then Pulse, because it's pulsating. I found it very effective. Actually, what I do is I add antiseptics to it. So from the lab, you have, because we have mucus in there, you can have a mucus killer chemical. It breaks down your mucus, and then it allows it to flush. And that's one of the best things out there, because for people suffering from allergies, viruses, name it. And it'll keep your immune system much more healthier, because it's not constantly fighting those all those minor irritations.
Sounds like fun, Paul.
Thank you.
There was one additional question here, and it says, regarding the at-home tests that were sent to us for free, we've read that there are many false positives or false negatives. What's your thought on that?
Yes, there are 2 tests. One is an antigen test, which is the quick, fast test that you get it for about $20. Now the government is giving out for free per household, about 4 or 5 of them. And then you have the PCR. And the PCR is polymerase chain reaction. So it's a multiplier, where the antigen has a fair bit of false negatives. So in other words, it will miss out if you have a COVID, almost close to about, say, 65%. So it is a good screening test. Mind you, it's much cheaper, much faster, and you don't need to be a lab tech and machines to read it. The PCR, it will take, say, 1 bug, it will multiply it, and then it will do a testing on a higher dose. So it is quite more specific versus, say, on the antigen one, you have 100 bugs, and then it turns out to be not enough for the test, and it gives you a false negative. On the PCR, you have 1 bug, you multiply it, given some time, and it goes up much higher in number. And now you can test it, and it is a lot more sensitive. So PCR is the go-to test, and the antigen test is actually just a screening test.
Thank you. Are there any additional questions for Paul?
No, I don't have a question, but I felt compelled to unmute myself to say, Paul, I can't thank you enough. This was one of the most educational and comprehensive presentations on COVID that I have heard, and I read a lot about it, but you did an amazing job, not only with the the statistics, but such good pointers for us, like baseball cap and the nose pump, etc. Just thank you so much. Really do appreciate it. Thank you.
You're very welcome. These are actually my own personal observation, personal experiments that I've done on myself. I'm a very curious person, so even in the lab, when people will say, well, you know, those knobs are clean, I'll go over and I'll swab them and I'll check them. And I'll give you one interesting example. If we have the time, do we have time, Kristen?
Sure, absolutely.
Yeah. When my kids were little, my son was, I would imagine, about, say, a little, maybe less than a year or something. And I saw him playing in the toilet water. That was his splashing pool. So I was working the lab, and my wife said, "Oh, did you notice that what he was doing?" I said, "I did, but what I'll do is I'll take a sample of the toilet water over to the lab and check it." Would you believe it? It had no bug whatsoever. And I said, that cannot be true. So I went and swabbed the toilet seat and then the underneath the seat, the part which is not the water, but at the edge of the toilet. And I saw a whole lot of bugs on the seat, but less so on the toilet rim. And again, water was very clean. When I say clean, not a single bacteria that we normally associate with infection. So what it tells me is that oftentimes we think because the feces are in the water that is dirtier, but since it flushes a whole lot, it's a low touch area. The high touch area is the seat and the toilet rim. And they had a whole lot of bacteria, not as much as your feces will, but my wife felt very comfortable when I told her the water he was splashing was pretty safe. So that was something. And she said, "Oh, no, I need to get a second opinion on that one."
Well, Paul, lots of wonderful comments here. Just thank you so much for the information and the time spent to inform our community. Somebody said, I agree, excellent presentation, thank you. They appreciate all of the information.
You're very welcome. We have a lot of stories coming in from interaction with bugs, and it's amazing how consistently that these bugs follow a lane, whereas we crisscross, but these bugs are very consistent. And that is why, based on that consistency, I will say about 90% of the bugs are going to be following the nature-given tracks. And the 10% or less are going to be mutating, or they are going to rebel. I think 10% is too much. It's actually going to be less than 5, closer to about 3 to 1%. And those are the ones which cause these Omicron. They are the ones that cause the Delta variants. And if we did not wear a mask and we spread it out, then the whole world then actually comes down with it, and many people die. So I see, by looking at the bugs, that I get an idea about what people are going to be suffering. Now, there's a very interesting thing that happened when Omicron was still in the early stages. I would say middle of January. There was a report that came in from Boston that is most likely that we are not going to be seeing a bad case of this bug. And how did they make the determination? We have found by looking at the sewers, we take an inoculum of our regular sewers, and we find out what bugs are in there. The researchers in Boston found that the number of Omicron viruses were really coming down. Yet we were still peaking, but the bugs in the sewers started to come down. So we knew, and I know Dr. Fauci's mentioned in his news that we are hopeful that it will come down, and it sure did come out, as you see in the graph. So there's a whole lot that our body tells without us knowing it, where the researchers have picked up that people will lie, but the sewers don't. So it's amazing sort of science that's been put together, and hopefully we'll be able to harness and prevent future epidemics. But all in all, we are one little drop, but we all make an ocean. So we need to be on guard all the time.
Thank you, Paul. Thank you.
You're welcome.
Okay, right. Well, with that, I just would like to thank everyone for taking the time to join us today. Again, this presentation will be available in the coming days on the Community Hospice YouTube channel. So please feel free to share it with your friends or families. If you want to watch it again, you can do that as well. And then I'd like to invite you on March 10th, same time, same link to join. We'll be talking about preparing for the end. What survivors face after death, and what does that look like? So again, we hope that you'll join us on March the 10th. So with that, we're going to go ahead and end our session, and everybody stay safe, wear those masks and keep your distance and make sure to sanitize your hands frequently, right?
Lesson well learned. Thank you all.
All right, Paul. Thank you so much. Thank you, everybody.
Bye.